And good morning, everybody. I'm Alan Carpenter once again. Happy to have on the line with me Dr. Richard Doner from Compassionate Certification Centers for our second visit together. How are you, Doctor?
I'm doing very well, thanks. How about you?
I am very, very well. If you are listening for the first time to the Doctor and I Talk, tell me a little bit about Compassionate Certification Centers and what you do.
Sure. So Compassionate Certification Centers is a full-service medical cannabis healthcare organization that really is centered here in Pennsylvania, where we're able to see patients, help evaluate them for their medical marijuana certification, help outline a treatment plan, and provide ongoing support. So really we function like any other physician's office, just with a specialty in medical marijuana.
Now, we spend a lot of time, it seems, I'm sure you spend a lot of your time as well, sort of dispelling some myths about medical marijuana and about CBD as well, which is also part of what is offered from Compassionate Certification Centers. What are some of the myths that people have about marijuana, or the beliefs that people have about it that might keep them from seeking medical marijuana as a viable treatment?
Sure. This is a great question with regard to sort of the myths and misconceptions about medical marijuana, and I think there's sort of a handful of them. We had touched briefly during our last conversation. I think one of the big ones is that in order to consume medical marijuana, it has to be smoked, and this is not true. There's other routes of administration. So in order to medicate with medical cannabis, a patient does not have to smoke that, right? Another, I think, one of the misconceptions is that medical marijuana has a psychoactive effect, or that it will cause patients to have that stoned feeling. Again, this is something that's not true, and with medical cannabis nowadays, really the profiles can be controlled, and the psychoactive effect can really be moderated as well. So I feel that those are two of the biggest misconceptions that are really out there from a patient perspective.
It's interesting when you talk about that. I almost wonder if we shouldn't go even more basic, because I think some people assume that the psychoactive effect of marijuana is itself the therapeutic effect, and that is far from the truth. It's not a case of, well, it'll make you sort of forget your pain. It has serious medical benefits.
You're absolutely correct. And when you look at medical marijuana, there's actually a whole bunch of active, physiologically active components of it, really. So THC is one of them. As you mentioned, CBD is another one. So really, each of these different cannabinoids has their own physiological profile to it. So there really is a lot of science behind it, and it's not necessarily a one-size-fits-all type of treatment. Each patient oftentimes will respond differently on an individual basis to the different strains and the different routes of administration available.
And as we talked about last time, and I think it's something that people who really are just starting to think about this therapy for themselves for the first time need to understand, is there is no toxic dose of marijuana. And as far as pharmaceuticals, I don't care if it's a blood pressure med, I don't care if it's a Paxil, whatever it is, they almost all can be dangerous when taken in excess. With marijuana, especially with marijuana that is standardized and tested the way that Compassionate Certification Centers offers it. There is no lethal dose. There is no overdose with marijuana, and that's important for people, especially who are just thinking about it for the first time, to understand.
Absolutely. It's a very important point. I'm glad that you brought that up. I said this during our last interview, but during our event the last 2 years, Dr. Cyril Weck, the world-renowned forensic pathologist, he made a profound comment, essentially stating that out of the tens of thousands of autopsies that he's performed, never once has endocannabinoid toxicity been a cause of death. So your statement is absolutely correct. There is no lethal dose of cannabis. So a patient cannot take enough cannabis to, for example, have them stop breathing or to die. This is really a profound thing in medicine and pharmacology when you talk about it. And really even beyond that, the safety profile of medical marijuana, generally speaking, I would say is much higher than most traditional medications that are on the market today.
Yeah, you've got double safety in it, number one being an inherently safe product organically, but also with medical marijuana, with how much of each ingredient is in there, and the purity of the product. That makes a huge difference.
Absolutely, and that's one of the great things about Pennsylvania's program is that it's mandated this testing so that when patients go to the dispensary and they obtain their medications, they'll be able to literally look at a box or a barcode and be sure that there's no pesticides present, there's no heavy metals present, and that the medication that they're getting is as advertised and it contains what it's supposed to contain. So really a critical component of any medical cannabis program, and I think that really goes beyond the dispensaries and into these hemp-derived CBD as well. Mm-hmm. Really, anytime a patient is putting something into their body, they have the right to know exactly what that is and make sure that it's safe, consistent, and repeatable.
As I said last time we talked, I think the first time a lot of us began to hear about medical marijuana and think about it was probably for treatment of glaucoma and maybe for people who are undergoing chemo. What is remarkable when you begin to research just, as a layperson, medical marijuana, what's remarkable is the variety and the number of conditions it can be used to treat. But again, with a caveat, as you said, that every individual case is different.
Absolutely, and what not only every individual case, but what you see is that across different state borders, each state's medical marijuana program might have different qualifying conditions. For example, Pennsylvania, we now have 21 qualifying conditions. We had started off with 17. The advisory board had added some more conditions onto those, and then hopefully moving forward, there'll be further conditions added. However, I would tell patients to use caution is that our laws here in Pennsylvania may be completely different than, say, the laws in New York or Ohio. So even in an adjacent state, really the laws are dictated from a state-level regulations or mandates.
When I'm imagining in my mind, if somebody is coming to you as no experience of marijuana, maybe in the past in a recreational way, and they're just coming to you saying, I've never used it, never been around it, but I want to try it for medical purposes. What's the process?
Sure, it's a great question. So there's a few different ways about this that patients can really pursue medical cannabis as a treatment option. I think obviously, like we spoke about, a patient obtaining their medical marijuana certification, their card, is one option, particularly if the patient has one of those 21 qualifying conditions. Alternatively, let's say the patient doesn't have one of those qualifying conditions. It doesn't mean that medical cannabis therapy is not for them or available to them. And really, for those patients, a hemp-derived CBD or cannabidiol-based product may be the way to start. I always tell patients one of the best beginning points is either to go to the State Department of Health website or alternatively to go to an organization such as Compassionate Certification's website where they can find some basic information and really how to begin that process. Oftentimes there are components that are in place to help walk patients through the process. For example, if you contact our office, our staff has been trained to take patients step by step through the process of really obtaining your medical marijuana certification, getting appointment and getting an evaluation. So my recommendation to people would be really your first step is the Department of Health website or an organization such as Compassionate Certification's website to start the process off.
And sometimes, I know with CBD oil, I know this personally, sometimes word of mouth is such an important thing. I think I was sort of the first one on my block to use it, and I use it for to bring down my blood pressure, and I also use it because I find it helps with regulating my blood sugar, and I'm a type 2 diabetic. But as soon as I started using it, I discovered people on social media and my friends would say, well, I have back pain, and I am able to avoid taking a lot of the stronger meds because CBD helps with back pain. And as I mentioned last time, I have a friend who has seizures, and he finds that it really helps him to uses seizure meds less. He still uses them, but he doesn't have to use them as frequently or as often with CBD. So what's interesting is I think a lot of people get intrigued because someone they know is using CBD, for example, and then they begin the research online.
I think you're spot on again with this, and I think really that goes deeper into the whole medical marijuana or medical cannabis movement in our country and across the globe. And we had touched on this during our last conversation, but really one of the unique aspects of medical marijuana is that it's been a patient-driven movement or a patient-driven paradigm shift in our healthcare and way it's delivered to our patients. Medical cannabis really offers the patients the opportunity to take things into their their own hands and really individualize their own treatment plan more so than traditional medicine has allowed. I think that's a very, very encouraging thing for patients, and oftentimes that can be relayed to family, friends, colleagues, and it will have a profound or significant impact. So I think that word of mouth, as you mentioned, is critical, and really the reason we are where we are today in our country with the medical marijuana program is based off that idea or thought process.
And when we were talking about some of the misconceptions, you mentioned a really important one for a lot of people who don't want to smoke. You don't have to smoke. And it's kind of interesting with both medical marijuana and certainly with CBD. There are so many different ways to use it. I know what surprised me with CBD is the people, I have not yet tried this, but the people who use it in a salve directly to their aching muscles rather than use a tincture or use an edible.
Again, correct on this, and there's so many different routes. I think the tradition and the stigma with regard to marijuana is that it must be smoked. But when you're talking about medicine, it's actually not true at all. And medical cannabis can be delivered in a number of different ways, whether it's vaporized and inhaled, whether it's taken orally through an edible or an oil or a tincture, or as you alluded to, the topical preparations, a gel, a cream, or a lotion, which we've noted to be very, very effective for patients, particularly when you come to talk about treating conditions such as chronic pain or maybe topical skin disorders such as eczema or psoriasis. And really oftentimes a combination of these different routes of administration is the most appropriate in a patient's treatment plan. And even the route of administration can cause different physiological effects with regard to the medical cannabis. So, for example, an inhaled preparation of medical cannabis might work very quickly within a matter of seconds or minutes, but it might not last that long on the back end. Versus an oral preparation, it may have a delayed onset, take an hour and a half to really kick in per se, but then it would last much longer, 6 to 8 hours. So depending on the patient's set of symptoms and what the disease processes we're trying to eat, that can help define what route of administrations are the most appropriate for the patient. But the bottom line, as you mentioned, you absolutely do not need to smoke medical marijuana in order to consume it as a medication. And to have it be effective. That's absolutely the case. I'm kind of interested, too. You're certainly a person who's on the cutting edge of this. We're sort of just beginning to understand and to really realize the many benefits of this as a medicine. I mean, the research is pretty encouraging, isn't it? The research is, in my opinion, profound at this point, and I think it's just going to continue to come in waves, and we're going to see even more of it coming out. I can tell you, for example, that even our institution, we've started incorporating research into our daily operations. We're doing a study right now on CBD and its effect on irritable bowel syndrome. I know there's research going on with regard to anti-cancer properties, potentially, of medical cannabis. Work on diabetes, traumatic brain injury. So really, some of the things that maybe we've never even considered would medical cannabis would play a role, we're starting to study those now. And to me, it's a very, very exciting time because as the days and the weeks and the years tick by, where more and more research is coming out to support the therapeutic value of cannabis. And if people are just listening now and saying, I don't quite understand some of the terms you're throwing about, describe for me and tell me about the difference between hemp-derived CBD and the products you have at compassionate certification centers. Absolutely. So, and this is a common place of confusion or misconception, I think. So when you look at the type of products that we sell at compassionate certification centers, these are what we call hemp-derived CBD or cannabidiol. So CBD is one of the cannabinoids that's found in the marijuana or the cannabis species. And however, it can be derived from the hemp plant. Hemp, by definition, is a species of cannabis that is very high in CBD and very low in THC. Based off the recent updates of the Farm Bill or the Farm Act, hemp is now legal completely in the U.S. So you can derive CBD from hemp, and it can be therapeutic. That is what you will see sold at institutions or organizations like compassionate certification centers, or maybe your local apothecary. Conversely, the medications that you buy at the dispensary are what we call full-spectrum medical marijuana preparations. And what these mean is that these have a very wide variety of cannabinoids, and in particular, they contain the cannabinoid THC. And THC can be therapeutic, but it's also the psychoactive component of medical marijuana. So whenever you hear somebody talk about a full-spectrum medical marijuana product, or somebody is buying their medical marijuana from a dispensary, these are products that most often than not contain THC in them. So really, that's the delineation. One is derived from hemp, the other is derived from the female marijuana flower.
But I think it's also important to note for people that say, okay, well, I'm interested in medical marijuana. I don't want to feel high. I don't want to feel stoned. I just want the benefits. That's absolutely doable.
100% that's doable, and to be honest with you, that's really what we go for. Whenever you're looking to treat somebody with medical cannabis, the goal is really to have therapeutic results without any unwanted or even psychoactive results. So, and my best analogy to this is that whenever we have small children come to see us, if we have an 8-year-old with seizures or a 12-year-old child with autism per se, we're able to design a medical marijuana or outlay a medical marijuana treatment plan for these patients that can be therapeutic but is non-psychoactive. And this is 100% achievable, and it's done so on a regular basis.
And again, that's one of the benefits of dealing with, a center like compassionate certification centers, where things are standardized and tested, and you know exactly what's in every product you get.
Absolutely. That's completely correct. And not only that, but many patients with medical marijuana, whenever they first start, they don't get the results that they want immediately. It can take some time. I oftentimes use my own mother as an example here. It took me about 4 to 5 weeks to really titrate her treatment plan to what was effective and tolerable from her end. It's really important that you have an educated medical professional who understands medical cannabis and is familiar with it, who can guide you down this path in order for it to be the most effective and therapeutic for the patients.
Let's talk about the actual process of getting your card, because it is still relatively new to most people. I don't know if they know how this all works.
It is very new, and sometimes the process can be relatively cumbersome. So fortunately, there's organizations like ours and others that can help patients walk through this process. So really, when you're talking about what's the first step that the patients need, when it comes to obtaining their medical marijuana certification card, it would be to review the 21 conditions and see if you have one of those conditions. The next step for the patients is going to be to see one of the providers who, specifically a physician, who is listed on the state medical marijuana physician registry. Right now, there's about 1,000 physicians across the state. This could be a patient's PCP, but it may not be. Either way, what the patient needs to do at that point is set up an appointment with one of those physicians. These physicians can be found on the State Department of Health website under a registry that is listed for there. Once that appointment is initiated, the patient then goes to the office just like they would any other doctor's appointment. They're evaluated by the physician. A medical marijuana treatment program is outlined. It's made sure that the patient is appropriate, and then at that point, the physician can help the patient to initiate their actual medical marijuana certification. At that point, the patient will receive a medical marijuana identification card in the mail, which they then take to one of the licensed dispensaries in Pennsylvania. When they go into the dispensary, at that point, typically that's where the medication will be dispensed, and that's whenever they meet with one of the dispensary pharmacists who, again, can help support and provide information with regard to their treatment plan. So really the first step that I advise patients to do if they're interested in medical marijuana would be to either go to the Department of Health website, or alternatively, they can pick up the phone and call our 888 number and talk to some of our staff who can walk them through the whole process and answer any questions they may have.
It's interesting looking looking at, and I made a joke last time, but it's really true. You have so many qualifications, such an extensive background. We'd use up most of the half hour just talking about it. But one of the things in your background is you're certified in hyperbaric and wound care. And, I'm thinking that these products, because of their anti-inflammatory and healing properties, have got to be particularly intriguing to you with that being part of your training.
Yes, and I'm so glad you brought this up. It's not often, but really the hyperbaric and the wound care, they have a direct correlation to my practice in medical cannabis. And I think you mentioned one of the points, particularly hyperbaric medicine, when you look at its anti-inflammatory properties and its healing properties, they're very similar to some of the cannabinoids, and I think that they can work synergistically. Wound care is another area that really medical cannabis has not been studied or integrated on a large scale. However, when you look at the properties of many of the cannabinoids in medical marijuana, they absolutely will most likely, in my opinion, have a role in wound care and wound healing moving forward. So for me personally, it's been a direct correlation and something that continues to grow over time, and as I learn more about all of these fields.
It's interesting, too, you mentioned earlier IBS, and if you know anybody, listeners, if you know anybody who suffers from IBS, it is sometimes the people with IBS are almost prisoners in their own home or in their own office because they can flare up so badly, and obviously Crohn's is the same thing. When you're talking about these kind of products as anti-inflammatory and natural for those kind of syndromes, they can really be game changers.
They can absolutely be very, very effective for patients, and not only with irritable bowel syndrome, but also with inflammatory bowel syndrome, as you mentioned, Crohn's and ulcerative colitis. We've seen tremendous results with some of our patients, not only from a symptom management standpoint, so to help reduce nausea, pain, cramping, to increase appetite, but also really long-term to help sort of reduce the chronic inflammatory process and potentially even help provide some regulatory status for the immune system as well. So for those type of disorders, irritable bowel syndrome and inflammatory bowel syndrome, I think medical cannabis is a fantastic treatment, and we've seen results firsthand that have been very, very encouraging.
Yeah, that's what's really intriguing as our time winds down, but that's what's really intriguing to me about it is medical cannabis and CBD, as the literature says, it helps to restore homeostasis to our system. So, if our immune system is off, if we have Crohn's or a syndrome like that, the central nervous system is off with seizures and so forth, these products don't just help to treat symptoms, as you said, but help to restore that or get closer to that balance that our body should have.
That's absolutely correct, and largely we believe that this revolves around the fact that every human being and every mammal, for that matter, they're born into this earth with an endocannabinoid system. So this is an endogenous system of receptors and chemicals that bind to them and then act on these receptors and cause a physiological response. This system of neurochemical communication, if you call it, works very similar to other systems in our body that we're familiar with: norepinephrine, dopamine, and serotonin. So the same way that we try to augment or modulate those systems, we can do the exact same thing with the body's endogenous endocannabinoid system. And fortunately, we have a natural plant available at our fingertips to help us do this. So it really is a profound and amazing thing, and I think we've just scratched the surface at this point.
I think you're right. Let's talk a little bit about how to get in touch if people want to know more, if they want to seek their card or know more about the products. How do they find out more?
Yeah, so you can simply go to our website, which is CompassionateCertificationCenters.com, or alternatively, you can call our toll-free number, 888-316-9085. Our staff would be able to help you and really answer any questions or walk you through the whole entire process. Even if you really just have questions, feel free to call or contact us, and we'd be happy to answer.
Terrific. Dr. Brian Doner, thank you so much.
Thank you. Have a great day. I appreciate it.
You too. Thank you so much. Always fascinating stuff. We're going to take a break. Coming up next half hour, we'll talk to the folks from Bayada Nurses.
emotions, will was you. I tried to push, tried to keep us all down.